Health and Human Services Secretary Robert F. Kennedy Jr. on Friday made some eyebrow-raising statements about those who have contracted COVID-19. He said that healthy Americans were not dying of the disease and that it only affected sick people. Kennedy's comments came Friday while speaking at an event alongside West Virginia Governor Patrick Morrisey, where he praised the state for its recent ban on food dyes. He's made similar claims in the past about other illnesses like the measles. Let's bring in Dr. Celine Gounder for more. She's a CBS News medical contributor and editor-at-large for public health at KFF Health News. So, doctor, what do you make of those claims?
This feels like victim blaming, saying that people had underlying medical conditions and this is their fault if they died from COVID. We also know that in the United States, we have very high levels of chronic diseases. It's quite common. Somewhere between 50 and 70% of Americans, depending on how you define chronic disease, have chronic diseases. And so a significant proportion of the population is at increased risk for complications from COVID. It's not helpful to go around blaming people. What you really need to do is how do you mitigate risk? How do you reduce risk? How do you help people through a pandemic?
Also, the entire staff of the federal government's Office of Infectious Disease and HIV/AIDS policy is expected to be laid off. This is according to multiple health officials who tell CBS News. This is part of a broader restructuring by Kennedy. What will the impact be?
Well, we are seeing, as they put it, having the CDC refocus on its, quote, core mission of fighting infectious diseases, epidemics, and pandemics. But at the same time that they're saying that, they are also dramatically cutting those very kinds of programs. For example, the NIH had one program to develop antiviral drugs. So you remember Paxlovid for COVID. Yeah. We have Tamiflu for the flu, trying to develop additional medications like that for other viral infections that could cause pandemics so that you have options should there be, say, a bird flu pandemic. That entire program was terminated. Another program to develop a vaccine, what we call a pan-coronavirus, pan meaning all. So in other words, it would be effective against many coronaviruses, in particular, many of the variants of COVID. That program to develop that kind of vaccine terminated. So the very things that you would want to see happen to improve our epidemic pandemic response, which they say is what they want CDC to do, is being terminated. So it feels like actually they're trying to marginalize the agency, pull out the things that Kennedy is supportive of, his pet issues, so to speak, and to leave a very marginalized, defunded CDC behind.
Well, the Trump administration this week also announced plans to cut billions of dollars from state health services. So this includes pandemic-era grants. Could this affect, for example, efforts to curtail the measles outbreak?
For sure. So we're looking at over $11.4 billion that's being pulled back. This is CDC funds that, as you said, were allocated during the pandemic. One of the things we realized during the pandemic was that public health, state and local health departments were dramatically underfunded for decades. And so that's why when we went through the pandemic, they were caught flat-footed. We're just now trying to mend this threadbare public health system, and that money is being pulled back. And so, for example, how does that apply to measles specifically? Wastewater surveillance was one of the things that we put into place during the pandemic. That is a way of having an early signal. Hey, in these adjacent counties, this is where we're starting to see measles transmission, even before people get sick, where you can rush in with vaccination. Wow. So that's a tool that's being pulled off the table. Another is the ability to set up vaccination clinics, fairs, for example, where people can go. And then how do you address vaccine skepticism? And that does require having community health workers, people who are trusted, who have those conversations. And just the having of those conversations seems to be controversial right now.
Well, Dr. Celine Gounder, thank you for covering so much ground in your world this week. Appreciate it.